Good afternoon, everyone. Stephanie Susskind here. Hope you're having a good afternoon today. We wanted to have a conversation right now with one of our local pediatricians about the COVID vaccine, the Pfizer vaccine, now authorized, now out there for children 5 to 11 years old. This was a huge development this week, and we know a lot of parents may still have some questions out there. So I'd like to bring in Dr. Tommy Scheckman from Pediatric Partners right here in Palm Beach County. And Doctor, we know you are busy. We really appreciate you taking the time to talk with us today. How you doing?
I'm doing great, Stephanie. Thank you for having me.
Absolutely. So let's jump right into this. The vaccine, it is approved, it is rolled out. We've seen some children start to get it. What are you hearing from your patients, from your families about this vaccine? What type of questions are you getting about it?
So first of all, I think that it is an exciting milestone for us here as pediatricians to be able to have something in our toolkit to start fighting the pandemic, to keep our children, school-age children specifically, and now 5 to 11-year-olds, trying to keep them safe and healthy and returning them to normalcy. We've had quite a bit of excitement from parents. We already have, we're doing a double clinic in 2 of our offices next weekend, not this coming weekend, but the 13th and 14th. And we're already over booked. And so I'm excited to see that there is such a great demand. And our hope is that obviously that we sustain it and be able to vaccinate as many children as possible in the next few weeks.
Yeah, this is something that, a lot of parents of young children have been waiting for, but also does cause some parents some concern. So for the parents out there, I've heard a few say, why does my child need this vaccine? If, the impacts of COVID are not necessarily as severe for children as it can be for adults. How would you answer that? Why does my child need the vaccine?
So it's a great question. The fact is that, children, thank goodness, do not get as sick as do their grandparents, but they still can get sick. And certainly in just this age group alone, we have already seen in the United States 1.8 million children between the ages of 5 and 11 become ill with COVID that we know of, over 8,000 hospitalizations, and then on top of that, 94 children have died. So there's also children who have long haul syndrome, and some of them have complications of something called multi-inflammatory syndrome of childhood, which often involves the heart. And these are issues that may remain with the children for years to come. And so we want to give every child, like we do with every vaccine, the best opportunity to succeed and to avoid vaccine preventable diseases. So that's why we need to do it. The vaccine is safe. The benefits far outweigh any type of even theoretical risk to the child.
And talk about that a little bit more too. Of course, parents are concerned about side effects, about risks, but the trials have really shown this to be very safe for children.
Right. So the clinical trial in this specific age group was approximately 3,000 children who have received the vaccine. And juxtapose that in the fact that just in the last 9 months, there have been over 1/3 billion doses of this vaccine given. And yes, to older children, but children 5 to 11 are physiologically not that different from teenagers who have been receiving the vaccine. So the vaccine, certainly, the trials showed that you can have some mild to moderate side effects. You can have some pain at the site of injection. You can certainly have some fatigue, tiredness, headache. Those symptoms typically are going to last no more than 24 or 48 hours. In the clinical trials, there were no serious adverse side effects determined or detected. So that, yes, we are going to continue, like we monitor for every vaccine that we provide, the fact that we'll keep a close watch, especially because these are our children, and we certainly are trying to give them the very best to make sure that nothing, as we start vaccinating more children, we will continue to monitor to make sure there are no adverse side effects.
And what are the conversations like in your office with, I know you've have a lot of parents excited. You said you're overbooked already for vaccine clinics. What are some of the parents saying to you about it?
So when I say that, obviously those are parents that have been calling us for weeks. waiting for this day to arrive, and that's exciting. Certainly, we also have a fair number of parents who are either hesitant, have questions, and we're here as their pediatrician, their trusted pediatrician we're here. We've always been here to help guide them to do what's best for their child as far as their health care, their safety. And there are those parents who say, I'm not going to vaccinate my child. They may have already vaccinated themselves, they're teenagers, but not willing to look at the school age child to vaccinate them. And our job as pediatrician is to, gain their trust and educate and advocate. And so we will continue doing that. And hopefully we will continue to be able to make inroads into vaccinating all children. One of the things that we need to recognize as child advocates, as parents, grandparents, as pediatricians, as educators, is that this pandemic has had a major impact on children. And whether it's because they've lost a parent, and unfortunately we have those patients in our practice that have lost a parent, certainly grandparents, or in one case, a sibling. The fact is that the mental health of these children, of all children, and of their parents, quite frankly, but certainly as a pediatrician, we are seeing a rapid rise in patients presenting to us with mental health illness, whether it's anxiety, depression, agitation, sleeplessness, and we also know it's impacted their education. Certainly, there's estimates that kids have lost 18, some people even say close to 24 months of education being interrupted. So this has had an impact. This pandemic has. So even for those that have not been sick, even those that are, have had mild illness, we know that the best opportunity we have to return to normalcy for our children, our grandchildren, is to vaccinate. Our best tool is vaccination. And that's the way we're going to overcome this and defeat this pandemic and provide a wonderful future. As one parent said to me the other day, the future is now bright. It's been very gloomy for the last 18 months, and it has, but the future is bright now that we can vaccinate our kids.
Yeah, and we have a comment from one of our viewers right now saying thank you for this valuable information. So we're glad we could bring this to the public and make sure that everybody kind of gets those questions answered. And to your point, about being able to vaccinate the younger children now, is that kind of, this is our next step in trying to get out of this whole thing?
Absolutely. I think that we need to continue. And again, there's still, unfortunately, lots of preteens and teenagers that are not vaccinated. We need to give them the same opportunity. Parents, the entire family, the entire household needs to be vaccinated. We recognize that we are following, and one thing that needs to be said, Stephanie, is that we are following science and data. And science and data does not lie. It gives us the facts, and the facts are we know vaccines work. It is incredible that through these trials that we saw a 90.7% effectiveness of this vaccine. That's amazing when we look at other vaccines. We also have to recognize that, people say, well, this is a new vaccine. Yes, it's a new vaccine for a new disease that has just come, to this world, I guess. It's the best way of saying that. But we as pediatricians, as scientists, we have been working with vaccines. We know the science of vaccination. It has not changed in, decades. So we're as pediatricians, our business is vaccinations. Our business is prevention. And we need to continue to prevent disease that can have a major impact, including death on a child.
Absolutely. And when we look at this age range, this is now approved 5 to 11. That is a pretty big range. We've got our little babies, barely, kindergartners up to, really middle schoolers. Are there any other concerns, that parents may have, with the little ones versus, the older end of that age group?
No, I mean, again, I think that what we have to see is that children, the younger a child is or an infant, they respond to vaccination far better than adults do in general, across the board. When we look, they have a much better immune response because their bodies are naive. Their immune system is working well, and vaccination works in young children. So I have no, long-term concerns. I know there's a lot of misinformation out there in social media, on the internet. But again, we need to understand that when we are dealing with the science of vaccination, that we have learned so much over the last 70, 80 years in that field. So it's not new, it's just a new disease. And we have been doing this for years. We continue to introduce new vaccinations. Okay, so against diseases that are important. I mean, it hasn't been that long since we, put on the, opportunity for teenagers to receive a vaccine that prevents cancer, which is just incredible. It's the only vaccine we have, and that's relatively new. But again, it's no different. When it came out, I don't totally recall, but I think the number of patients in those trials were even smaller, and it was rolled out. So again, science is done based on facts and data, and the data does not, data leads us to the right conclusions. And I think that's why it was a unanimous vote by the CDC and the FDA to approve this for this age group.
And of course, then the next question is, our babies, our toddlers, those under 5, would that be next on the horizon?
Right. So yes, we hope so. And certainly I know that there are trials already being done, for infants 6 months and older. But, I certainly don't have an inside track, Stephanie, to know when that's going to, occur or be ready. What I'm hearing is probably the same thing you're hearing, is probably early in 2022. So in the meantime, what we have to do to be able to protect our smaller children, our toddlers, our infants, is to ensure that everyone around them is vaccinated, okay, especially their older siblings. That is the best way that we can protect them. Remembering also, not only does vaccination protect the child, okay, it totally protects the child to keep him or her healthy and safe, but it protects those around them, whether it's in the household or in their community. And we know that children are the vectors, are the spreaders, are the ones that transmit not only COVID, but other viruses as well. So it is the most important thing. If we look at, we're in flu season right now. Again, a reminder to everybody who is listening that everybody 6 months and older needs to get their flu vaccine. Fortunately, we didn't see much flu last year because everybody was social distancing, everybody was masked, but we know that's not happening now.
Right.
Although people should still continue to be wearing masks and practicing good hand hygiene and social distancing if they're indoors. However, having said that, we know that children, although not typically, they can miss a lot of school when they get flu. But the important, and most, yes, there's always several hundred children every year that die of flu, and the fact is, they're the ones that spread it to their grandparents, to those that are immune deficient, those that do not have, because of cancer or being on chemotherapy or having autoimmune diseases, may not have adequate, immune system and responses. So it's our children that we need to not only protect them, but they need to, by being vaccinated, protecting the rest of the community. Same flu, same as with COVID.
Very good. Well, Doctor, I know that you are busy. You've got patients to see. We really appreciate your time. Any parting words that you'd like to say to our viewers on the topic?
No, just as a grandfather, as a father, as a pediatrician who's been in this business for a very long time, seeing what vaccines can do. When I started practicing over 30 years ago, there was before the advent of Haemophilus influenza or pneumococcal vaccines, we were getting calls almost every other night with kids getting sick with meningitis, infection of the brain or pneumonia. And so we have made such an impact. It's made such a difference. We can now look at a lot more positive things when we deal with trying to give children their head start. And we need to do the same thing here for COVID. And we can, if we all as a community get together, do the right thing for our children, do the right thing for our community.
All right. Thank you so much. We really appreciate your time. And for our viewers on Facebook, we appreciate you joining us. And this full video will be posted right on our page so people can go back and take a look at it, any questions they may have missed. And we certainly appreciate you taking the time to talk to us today.
Thank you, Stephanie.
All right. Thank you.